Hello, my name's Philip Lua and I'm very proud to be the chair of our trust. This is the first of a series of videos that we are going to publish to allow our governors to share their experience of what they're doing at the trust, how they are fulfilling their statutory responsibilities, and specifically for this video, how we're keeping them involved during the pandemic. You are going to hear from Stephen Baines, who is our lead governor, and Lindsay Smith, one of our elected staff governors from the admin, clerical and management staff group. Stephen and Lindsay will give you their governor update, and then you will be hearing from Zebby Deluse. Zebby is just one of our many wonderful colleagues who've gone above and beyond to provide compassionate care for our patients throughout the pandemic. She is going to share her experiences of being redeployed to our intensive care unit. I hope you'll find her story as interesting and as moving as I did when I first heard it. I continue to be amazed and humbled at the lengths my colleagues, clinical or non-clinical, have gone to during the pandemic. You all make me very proud indeed. So without further ado, I'll hand over to Stephen and Lindsay.
Hello, my name is Stephen Baines. As Philip has already mentioned, I am currently the lead governor on the Trust Council of Governors. This is the body that, amongst other things, holds the board to account for the performance of the Trust. It has been obvious to us as governors that the welfare of colleagues has been of paramount importance to the Trust throughout the last few months, and our workforce teams have all been working really hard to ensure that colleagues have the correct support mechanisms in place, get the right amount of downtime and have outlets to express how they are feeling. We hope that this has been beneficial to you. I'm joined by my fellow governor, Lindsay Smith, who is going to give you a glimpse of what life has been like for her at CHFT since the virus hit back in March. I'll hand you over to Lindsay now.
Hello, my name is Lindsay Smith and I wear two hats at CHFT. I am a clerical officer in the Child Health Department and also an elected staff governor for the admin, clerical and managerial staff group. This means that I sit on the Council of Governors. I'm not a union rep or anything, I am just elected as a representative from my staff group. I've learned so much since I took up the governor role and I feel really proud to work for an organisation that takes the role seriously and values the contributions that we as governors make. I'm going to reflect here on how things have been for me as a member of staff at CHFT since the pandemic struck back in March, and also how as a governor I have been able to continue to be involved. Since March this year, things have changed for my working life along with everyone else's working within CHFT. My role in admin means that I am office based, and once the pandemic struck, we needed an office revamp to make it possible to do our jobs. The first thing I had to do was pack up my belongings and leave, as there were too many of us in the office. It was a bit disconcerting leaving my comfort zone in the midst of a pandemic, but soon I was working from a clinic room in Acre Mills where I settled in nicely. As other staff from another department were using the other clinic rooms, I was still able to have conversations with people, so did not feel too isolated. As time went on, I managed to get hold of a laptop, which enabled me to start to work from home. I now do this on Wednesdays, going into the office on Mondays and Fridays only. I'm aware that many of my colleagues in admin roles have been working from home full time since the pandemic hit, and that they have felt isolated at times, so I count myself lucky that I have managed to strike a balance that suits me on a practical and also an emotional level. In March, along with other staff, I started to receive the daily updates relating to what is happening in the Trust around the pandemic, from the amount of inpatients who had tested positive, challenges around PPE stocks, and departmental changes in ways of working and placements, through to shout-outs to staff who were going the extra mile in really difficult circumstances. I felt really humbled by some of the stories I read, but also proud that I have been able to continue to provide a supporting service throughout the pandemic. The song choice for the day at the end of the bulletin has always made me smile. In terms of my governor role, Microsoft Teams has been a godsend. It was a bit of a challenge to get used to the new way of working at first, but it's now become second nature and has enabled me and the rest of the governors to continue to be involved and fulfil our role. Although 1 or 2 meetings were cancelled back in April because of the impact of COVID-19, it wasn't long before we were set up on Teams, which has meant we have been able to continue with regular meetings. We had our first formal Council of Governors meeting in July and it was a success. It's been a challenging time, but great to be able to keep in touch with everything that is going on at the Trust to deal with the crisis. I think everyone is realising that the days of 3-hour-long meetings in a boardroom with an hour's travel thrown in are a thing of the past. For me, the acts of kindness and togetherness between colleagues have been amazing to see, spearheaded by our ward and engagement team, who have reached out to teams, departments and individuals, whether they have been working on a ward, in a lab, on ICU or at home. In other words, everyone. One word to explain the last few months for me is different, but I know I'm not on my own. 2 phrases that describe how it's felt working at CHFT during the last few months have got to be one culture of care and work together to get results. There's so much evidence of everyone doing their best to look after each other and pulling together to get through this. One statement to mark the future for me is keep calm and keep going. We will get through this. I hope you've enjoyed hearing things from my perspective. If you would like more information about what being a staff governor is all about, visit the non-clinical information section on the intranet or feel free to contact me at lindsay.smith@cht.nhs.uk. Thanks for listening and stay safe, everyone.
Finally, on behalf of the Council of Governors, I would like to take this opportunity to say a huge thank you for everything that you have done and continue to do to treat our patients with compassion, to keep them and their loved ones safe, from clinical colleagues on the front line right through to all our colleagues providing support. We are eternally grateful to you all. Goodbye for now.
Hello, my name is Debbie Deluse. I am employed by CHFT as a paediatric physiotherapist. I had been redeployed during COVID-19 pandemic to work with the respiratory therapy team, predominantly working with or on the intensive care unit. Here I'm going to share my experience of my time on the unit. Having had previous respiratory critical care experience, it wasn't long before I got the call for redeployment. To be precise, it was 20th of March when I joined the wonderful respiratory team, followed by intensive training, and before I knew it, I was stood on the nurses' station on ICU thinking, how am I here? I was supposed to be on holiday in Dubai with my young family. I remember the voices of children and the singing of nursery rhymes that I was so used to being a paediatric physio, gone and replaced with the sounds of alarms, breaths, hissing of air pressure. The very sounds that once frightened me, and just like that brought me back to a very personal childhood experience in a blink of an eye. I had looked around to see most of the patients were sedated and ventilated, but then I saw a patient on a CPAP hood, awake, gasping for air. My heart broke for him as he was awake, seeing and feeling everything I was, but the difference being he was COVID-19 positive, struggling to get enough oxygen into his blood. I could see he was frightened as was I, but the difference was he was dependent on the care of the ICU team and on me. I smiled at him from a distance as I wanted to ease his anxiety, but then quickly realising he couldn't see me smiling through my FFP3 mask and my full PPE. So I waved instead, and he waved back. I was down to review and treat a patient next to him, which would involve clearing the chest of secretions, positioning to optimise ventilation and postural drainage, as well as exercises to help maintain joint flexibility. I came out from behind the curtain with my colleague when the registrar asked if we could assist the very man that I waved at into prone, to help him ventilate better and to help prevent the need for further escalation of treatment, which would subsequently mean sedation and intubation. We had received training for proning mechanically ventilated and sedated patients, and I had also witnessed this being done during a personal experience. However, assisting a patient who was awake on a CPAP hood was not routine practice, but clinically, during COVID-19, my colleague and I could reason why this was a method of treatment, which then became standard practice during COVID-19 and became a big part of my role. Proning required a risk assessment, problem solving and lots of patient reassurance, as well as recognising how difficult of a task it was for a patient who was struggling to breathe and who was tiring. Proning was a success, and the effects of this was instant for the patient and translated across to his PO2 and the work of breathing. I was moved by the patient's fantastic sense of humour. I leant closer to him to overcome the barrier of communication through the FFP3 mask, offering comfort and reassuring him that his oxygen was improving, while thanking him for the great sense of humour which kept us all going. He went on to do really well. I walked away that day, feeling that I made a difference. I drove home, struggling to hold back the tears, knowing that I did my best, and also knowing that my sister would have been proud too. I'd lost my sister when I was 14 to type 1 respiratory failure, secondary to a respiratory virus, while undergoing treatment for leukemia. The very symptoms that I see COVID-19 patients experiencing on ICU. Many would ask how I built the courage and strength to face COVID-19, for which I would reply, this was one of many reasons that gave me the strength and courage to get into my PPE every morning and walk onto the unit without any hesitation. I just knew instantly that this is where I needed to be. There was one particular day where the sadness became overwhelming. I could feel my heart sinking as I held back the tears from behind my mask, while my colleagues and I prepared to deprone one of our patients for the last time, so that the family could say their goodbyes via a video call. Reading medical notes and the difficult conversations with family who have not seen their loved ones for weeks and were not ready to let their loved ones go was heartbreaking. The pain and anguish was palpable. Families not being able to visit was one of the most difficult aspects of this experience. Plans to deprone were put on hold until the family were ready, and the team made every effort to give the family the time they needed. Then we had many stories of success. So what did success look like on ICU during COVID-19? Ones that particularly stand out is supporting to sick patients on the edge of the bed for the first time after being sedated and ventilated for 3 to 4 weeks. With the support of 3 physiotherapists and nursing staff, this was a remarkable milestone. Patients were so pleased with this achievement, and these baby steps to recovery where every step counted. There were tears, and lots of them. I helped wipe away many, as did many of my colleagues after me, as patients were too weak to lift their arms. The success kept on coming, where patients were supported to sit out in their chair for the first time and then stand. There were more tears of joy, but this time the patients were becoming strong enough and supported to wipe away their own tears. You could feel and hear the sound of success in the voice of the ICU team as they learned a patient had been successfully extubated and decannulated, which meant another step closer to being transferred onto the ward, where they would continue to be given the time to recover and supported by my colleagues to get stronger. And then came the discharge home news. Well, this was the ultimate goal, and once this was achieved, it was a wonderful feeling of success. I'm not going to lie, working with a critically ill patient has been physically and emotionally challenging. I have worked at my hardest and out of my comfort zone, but then I would look around and see my colleagues all doing exactly the same with such care, compassion, supporting one another, and not to forget the support of the general public. When you see this, it lifts you. It gives you this burst of this superpower you didn't even know you had. I would look around across the bays and see the nurse, the healthcare assistant, gently combing and plaiting a patient's hair. I would see the nurses ensuring families' final wishes were honoured with such precision and sensitivity. I would see my physio colleagues coordinating proning and chest clearance, the unit clerk, the housekeeper keeping the unit running, the doctors leading care, and many more health professionals. The list can go on. Seeing this really moves you. Everyone working together with a common purpose to save lives. Although working on ICU during COVID-19 has been challenging, in many ways it has been a privilege, and I feel honoured to be part of the team during the COVID-19 pandemic. Patients may have not known me, but I tried my best to get to know them, their story, their social history, through the medical notes, through the eyes, or the facial expressions, or simply by listening or holding their hand. Although they may never know me, I would like them to know that their life mattered. I give every ounce of my strength and skills to care for them. As for me, they were not just a statistic or a curve on the graph. They were a patient whose name I knew and will remember. They were a patient under my care and became part of their story. For those who lost loved ones, I hope they can take some comfort in knowing their loved ones were never alone. Their matching hearts that were sent out to them were with them too. As things settle and we have the time to reflect, I feel like the last 8 weeks I have been running on adrenaline and the support of everyone, and got what needed to be done. I now feel exhausted, but I can honestly say that I have grown as a person and learned so much. The experience has been life-changing in so many ways. Though things have settled, I'm not entirely too sure what to prepare for. The unsettling feeling of the calm before a storm for another wave, or to prepare to go back to my usual paediatric caseload, where the services were significantly reduced and will take a lot of time to restart and get things back to where they need to be. Whatever the future holds, I feel like with a little bit of me time, I will be prepared and ready for what that may be.
Well, I hope you really enjoyed hearing from the governors and Zebby. Thanks for watching and stay safe, everyone.